Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Welcome to today's episode of the DocTalk show, and we are going to discuss a very important field of medicine that concerns the heart. Heart disease is one of the most common diseases globally. It's a growing epidemic, and with me in studio are senior doctors in the field of heart disease from the Uganda Heart Institute. We have Dr. Okello Emi, who is the head of cardiology at the Uganda Heart Institute and a senior cardiologist, and Dr. Mwambu Tom, who is a cardiothoracic surgeon, also at the Uganda Heart Institute and head of cardiac surgery. You're most welcome to the show, doctors.
Thank you very much.
And again, I'm your host for the evening, Dr. Darius Wachi. So let's get down to business with regards to understanding more about heart disease. And we are focusing on adults, heart disease in adults. Why is it such a big problem in today's world? So maybe I'll start with Dr. Mwambu. Heart disease in adults, why is it becoming such a very big problem globally?
Yeah.
First of all, understand what exactly is heart disease.
Yes. First of all, when we talk about heart disease, it's a broad term. We usually say heart disease, but we're really meaning diseases that are affecting the heart and the blood vessels, because these two go hand in hand. When we develop as babies in the wombs of our mothers, the part of the tube that forms the heart also contributes to formation of some of the big vessels. So blood vessels and heart really structurally are the same, and the diseases that affect the heart, or the factors that cause diseases in the heart, are almost the same that cause diseases in the blood vessels.
In the field of heart disease, what are the common types of heart disease you've encountered?
Children who are under 5 years will have more of the diseases that, or the heart diseases that they're born with, so-called heart defects, or what we commonly say holes in the heart. And then those who are about 6 years to 15 will have what we call rheumatic heart disease. This is a disease that follows several infections with bacteria called group A strep. And this bacteria causes sore throat. You know, you've seen children coming home with sore throat and flu, and a certain group of children will overreact to this infection, and unfortunately this results in damage of the heart. So when you have a child who is between 6 years and 15, those will have more rheumatic heart disease. And then over 15, when you start going above 15 to about 30, it's the rheumatic heart disease, except that these are people who have grown up. They would have started to develop rheumatic heart disease from rheumatic fever that develops when they had the sore throat, early on when they're between 6 and 15, and now they're reaching adulthood. Most of them are young adults, and unfortunately most of them have now the long-term effects of this disease. Then as you go above 30 and to the 40s, high blood pressure starts to come in, and other acquired diseases like coronary artery disease that causes heart attacks. So you have high blood pressure, you have coronary artery disease, you have stroke, and then some long-term survivors of the diseases of the heart valves, which we talked about, rheumatic heart disease, will also be in that mix. So you have a variety. And because of lifestyle changes, you have people who are suffering from diseases of the blood vessels or the tubes that take blood. And this includes people who come up with blood clots, either in the legs or in the heart, and some people go on to develop blood clots in other parts of the body as well.
Which age groups would you see more of the surgeries regarding the heart disease, Dr. Mwambu?
Most of the children who are born with heart defects, they tend to be structural defects. Many of them are structural defects. And so you find that about half of those who are born with those defects require surgery for them to be able to live on, to survive.
Okay.
Now, when you come to the older children, and going into the adolescence, where rheumatic heart disease is really a major player, rheumatic heart disease, depending on at what level you catch it, can result into structural damages, especially to the valves in the heart. And when structural damage occurs to those valves, then we need surgery to be able to keep this patient out of heart failure.
So to kind of repair the valves.
Yes, so that we get the heart pumping, being able to pump its blood effectively to the body. Okay. Otherwise, it will either fail to pump out enough if the valves are tight, or it will pump very little because it is pumping some blood backwards when the valves are leaking. So for you to be able to have an effective pump out of the heart to the body, those valves will have to be either repaired or even replaced. Then as we go higher into the lifestyle diseases, the most common one and serious one is coronary artery disease. It is a very life-threatening condition because at times it presents itself when you have got a heart attack and collapsed.
Okay, but
So
there is surgery to
there
correct
is surgery to do that.
correct
So
it.
we usually have now two levels here, or two approaches. The one that is more common and which could be faster, and a faster intervention, is what our friends, the cardiologists, the interventional cardiologists like Dr. Okello are doing. They are going in, putting dyes through these coronary arteries and locating where the blocks are, opening up those blocks, and putting in small stents to keep the vessels open. That is called cardiac catheterization. And in addition, they do angioplasty and stenting.
Okay.
And he can elaborate more on that's his field of intervention.
Also discuss more on
So
the
when
treatments.
they realize that the blocks are too many, or the blocks are in very critical places where they can't reach, then the patients are referred to surgery, and that's when we do coronary artery bypass.
Okay. So, and the advantage is these surgeries are available at the Uganda
These
Heart
surgeries are
Institute.
now available at the Heart Institute, and we are slowly even developing more and getting into a more advanced levels of these surgeries. I say so because at the moment we do it what would be the original conventional way, where we stop the heart, protect the heart, and perform the operation, then restart the heart.
Okay.
That's open heart surgery on cardiopulmonary bypass, meaning we bypass the heart, we bypass the lungs, we use a machine to sustain the patient and the heart, and we perform the surgery. A stage reaches when the heart muscle is totally destroyed, either because a patient who grew up with their heart disease from childhood took long to get an intervention, and the heart muscle has all weakened, become dilated, and can no longer effectively pump, or you have got some other lifestyle conditions like excessive use of alcohol, and they end up causing an toxic effects of alcohol affect the heart, and you end up with a weakened heart. Some of those hearts have no other option but to
replace
overhaul,
the new-
like you overhaul the car engine. You overhaul the entire heart and get another heart, and that's heart transplant.
Okay.
For us to get there, we need legislation which allows us to get one organ from another person. That means that person dies, and you put it into another person, and it's being worked on right now. The bill is almost before Parliament.
The bill of transplants
for
for
organ transplant, be it eye, liver, heart, kidneys.
Okay.
It's being worked.
So remember, you are watching the DocTalk show. We are discussing heart disease with the senior experts in the field of heart medicine. And when we come back after the break, we shall discuss more about the causes of this heart disease. We have understood some result from infection, some children are born with, and some are acquired because of our lifestyle. So after the break, we shall come to understand more about what could cause this heart disease and why they're bringing so many problems, so much havoc to many Ugandans and in the world over. So send in your questions and comments to our social media platforms on Facebook, Twitter. You can also subscribe to our YouTube handle, that is the DocTalk Show, and continue watching some of these videos that we upload there. Okay.
You are watching the DocTalk Show.